I'm Carlo Di Clementi, and I'm going to talk with you this morning about, or this afternoon, about a behavior change model that we developed a number of years ago that might help pharmacists in working with their clients and patients. In terms of this presentation, is that you'll learn how that adherence to medication really requires behavior change. That information that you can give people is necessary, but it's really not sufficient to make a behavior change. And we talk about motivation. Motivation isn't one thing, it's multidimensional, and it includes multiple stages of change, as we'll discuss in a little bit. The hope is that these stages of change can assist pharmacists in understanding patient challenges and promote successful medication adherence. And finally, what we want to try and do is help you see how pharmacists can create motivational conversations that can support medication adherence. So that's what we're about over the next few minutes. So when we talk about motivation, a lot of times we say people aren't motivated if they're not doing what we want them to do. But it's not that they're not motivated, it's just that they're not motivated to engage in behaviors that other people or we consider harmful or problematic, or they're not ready to begin behaviors we think might be helpful. Motivation essentially belongs to the patients, to the individual who's making the change and their process of change. However, the important thing that we've learned over time is it can be enhanced or hindered by our interactions with others and is affected by events that happen in the life context of the patients. Often, a prescription to take medication is given to a patient, but it is seen and experienced by the patient as an imposed change. And there's a difference between an imposed change and a voluntary change. If I'm given the medication that I really am not sure that I really want to take, that I have a lot of questions about, or that I'm sure that I don't want to take, and it's given to me anyway, it seems like it's an imposed change. And that evokes resistance when a person is not ready or has significant ambivalence or concerns about adopting the behavior. So chosen change that has intrinsic motivation, that's motivated by the individual, has much a greater chance of successful execution as you go down the road. How do people change? Well, what we've learned over time is to change for people to change voluntarily. People change voluntarily only when they become interested and concerned about the need for change, become convinced that this change is in their best interest and it's going to benefit them more than it's going to cost them, because all change costs something. Um, they organize a plan of action and they're committed to implementing this plan. And then they have to take the actions that are necessary to make a change and sustain the change. These represent what we're calling the stages of change. So they're really different points in the journey to a successful behavior change. Completing the tasks, it's important. We made some labels for these different stages. So pre-contemplation, if they're not interested, contemplating, thinking about it, preparing, action, maintenance. Those are the stages, the labels. But the more important piece is if I'm in pre-contemplation, the challenge is I need to get interested and concerned about willing to consider making this change. If I'm in contemplation, there's a risk-reward analysis and I need to make a decision. If I'm in preparation, I need commitment to overcome procrastination and other things and creating a plan that's effective, acceptable, and accessible. And it's got to really have all three of those things to be fully implemented and continued. And then I have to begin taking the action and implementing the plan. And obviously no plan is perfect. So sometimes I had to revise the plan to make sure that I get effective action. And then finally, if I'm making a change that has to go on for a long period of time, so it's not just one course of medication, but it's diabetes and I need to be taking this medication on a regular basis, then we need sustained change and consolidating that change into a lifestyle. What's important about the stages is it helps you understand what you need to be doing. So if you're a provider and you have someone in front of you who really is not interested in making a change, your job is not to give them a prescription to change, and not to berate them for not being ready, but to raise doubts, increase client awareness of the risks and of the problems. So you do this genuinely trying to kind of bring those concerns out from the client. And then in contemplation, your job is really to try and build more reasons for supporting that support the change. And maybe help them see that they could overcome some of the obstacles to change. And then in preparation, you're developing a tailored change plan for them, um, and how they can kind of organize that in their own life. Because every change has got to be inserted into the lifestyle and the current life um, activities of the individual. And in action, you have to help them develop that and prevent relapse, prevent giving up or not following through, and adjust the plan as needed. And then in maintenance, your job is to kind of look at any longer term kind of challenges that might be there. And sometimes people just get tired of making a change. And so you try to help identify the strengths for sustained change and provide support for the individual. So if we think about that, how then could we promote successful medication adherence? Well, I would ask what the person actually thinks about taking this prescribed medication. I often think that we need to be seeing the thought bubbles of the individual when the doctor gives the prescribed medication. Because I think if you could look at what they're actually thinking, you would see that there's a lot of hesitation about taking this medication possibly. So listen to the patient to really understand their reasons, and the benefits of adherence that they have, especially if they're in the earlier stages of change. Help them build a change plan of action that's acceptable and accessible. And that includes kind of when, where, how they plan to take these medications. Um, just saying take it twice a day is not helpful unless you can help them kind of build how they're going to build it into their day. Check the skills and abilities to act. So, every change takes some skill. How they're going to access and time the medications, how they're going to manage any side effects, how they're going to get support, what are they going to use, a pill box, a timer, a spouse, or a family member to kind of help them stay on target in terms of doing the adherence. And then plan for anticipated obstacles and difficulties that are potential for slips and abandoning change. So a lot of times people do abandon change after they start it, and we need to kind of help them with that. And then highlight the signs and symptoms of taking this medication that give them the sign that they need to call the doctor or revisit the pharmacy. I know it's in the description of what when you take the package, and it's got a whole insert about how to do this and what to look out for. But having that discussion and having them hear it from a professional makes them a little more cognizant of what it is they need to be looking out for. So that's really how you would apply the stages to the different aspects of change in talking about medication adherence. Let's, if we give a little summary, successful medication adherence really requires behavior change. I think that's an important thing to realize. Successful behavior change really involves readiness to change. Readiness includes being interested, making a decision, making a commitment, to having a viable plan, having some strategies for implementation, and then building a new pattern of behavior. It's not really sometimes the Nike ads kind of just talk about just do it. It's not as easy as that. People have to build change into their current lifestyle. So listen to patients to understand their readiness and help them with the different tasks of the stages. And that really can be done in a brief intervention. Um, so help patients find their reasons. Don't impose yours. Offer advice and information, but make sure that you're asking for the patient's reactions and thoughts when you offer that advice so you can get the reactions that they have to what you're saying. And then remember, behavior change is a journey that you go on with the patients. I hope this has been helpful and gives you some ideas about how to work with patients as you're doing your job as pharmacists. Thank you.